Hi, my name is Renee Fullerton, and I serve as staff to the Health Workforce Council, and I'm Health and Social Policy Associate here at the Workforce Board. Eleni asked me to join you to help you give a better sense of what's going on with the healthcare workforce here within Washington State, and also what are some potential opportunities and solutions the board might consider taking on. I thought it would be good to start with who are we talking about when we talk about the healthcare workforce here in the state. So for my purposes, I typically include medical practices, hospitals and clinics, dental service facilities, behavioral health services, which is mental health and substance use disorder services, as well as long-term care, so skilled nursing facilities, assisted living, and home care. So one thing to take away from today is that healthcare workforce shortages are not anything that's new to Washington State. We've had these issues for decades, and though the job market does have cycles like any other, overall it's an area of the health workforce where typically we are not oversupplied. If you go back to the Healthcare Personnel Shortage Task Force work in the early 2000s, that time talked about a crisis as well in the healthcare workforce. And if you read back through the reports from those times in 2002, the language you could read right now in the Seattle Times or in the reports that we submit to the legislature discussing the severe shortage of healthcare workers in all areas of the state and nearly all health professions and how that's impacting patient care here in Washington State. So many of the previous issues that were identified in the strategic planning effort done 20 years ago, we've had some new complications arise that make the situation in 2023 a bit different than it was in 2002. So for one, we have a labor market that is still reeling from the impacts of a global health disaster that really has not been experienced in any of our lifetimes, and those will continue to reverberate from years into the future. We've had technological changes that have brought both opportunities and new threats. Telehealth and electronic medical records were not a major part of the healthcare system in 2001. Records lived in paper and had to be moved around manually, and sorting through documentation was incredibly challenging. Telehealth was hardly used at all. However, both of these things have seen massive implementation over the last 20 years for a net gain. But at the same time, they bring with them new challenges. Healthcare systems have been targeted by hackers and have experienced data breaches and ransomware attacks. And it's not just healthcare systems. Our educational systems as well have experienced ransomware attacks that make it difficult for teachers to teach. One of our community colleges is currently recovering from a ransomware attack, and it took out technology across the campus, including in classroom, which meant nurse educators who were used to implementing technological tools for their teaching suddenly were making do with whiteboards and markers. And some could do that just fine, and some found it pretty hard. And then all of this has been compounded by everything else that's going on right now. We have an affordable housing crisis, which is particularly in rural areas, leading to great difficulty recruiting and retaining healthcare professionals because there's nowhere for them to live. Homelessness is very much wrapped up with our affordable housing situation, but it also directly impacts the healthcare sector because of homelessness's huge health impacts that then must be taken care of when individuals are seen in the emergency departments or in other clinical settings in much worse health than they might have been if they had remained housed. Access to childcare is keeping people from accepting and maintaining jobs due to the sheer drop in slots that we've had here in the state over the last several years, and insufficient capacity even predating the pandemic. And then over the last 20 years, the cost of higher education has dramatically increased, with trillions of dollars added nationally to the student debt. And many healthcare positions require an individual to have a bachelor's, master's, or doctoral level degree before they're legally able and safe to provide services. Eleni asked me to explain a bit about what particular occupations are greatest need within the healthcare workforce. And that's going to vary depending on which subsector you're talking about. If you ask the dental practices, they will say they are short on dental hygienists and dental assistants. If you're talking about the hospitals, they will talk about their great need for nurses and other allied health professionals. But what I really wanted to bring to your attention is how interconnected the healthcare system is, and how I think somewhat uniquely a workforce problem in one particular part of the system quickly spills over to impact other parts of the healthcare system. A prime example that had a lot of discussion this year is how long-term care facilities are missing the staff required to function and fully staff all the beds that they have. As a result, they're not able to accept as many patients from the hospitals, and those patients are staying kind of stuck within the hospital system, leading to hospitals themselves being over capacity, diverting ambulances, which then means those ambulance drivers have to circle longer to find a place where they can take their patient, and also not taking transfers. On the dental side, we see patients who can't access services either due to capacity with not enough dental assistants and dental hygienists to fully staff a clinic, or insurance issues and no ability to pay for those services. And as a last resort, they end up in emergency departments in severe pain. And then our behavioral health agencies are having trouble finding enough mental health professionals who typically require a master's degree or higher to qualify to assess and diagnose their new patients. And this is leading to long waits for those important intake assessments, and untreated patients are ending up in emergency departments or in jails. So why is the healthcare labor pool feeling so empty at this particular point in time? So in thinking about the complete healthcare workforce labor pool, I like to break it up into a couple different groups. So the largest of those would be people who are currently working in the healthcare field. And this is the group that we really need to focus on retaining. Retention is impacted by a number of different factors, some of which employers have a great ability to influence, and others, like government levels of reimbursement impacting wages, are further outside of employers' control. So to contrast with those currently working in the field, we have the group of people who are not available to work because they can't. Some of those people have been directly affected by COVID illness, both sickness and actual death within working age groups. The Department of Health has estimated we may have 100,000 people here in Washington State who have long COVID to the extent that it has impacted their ability to work. And then we also have individuals due to inability to access childcare or need to step out of the workforce to take care of an elderly family member or a disabled family member, and they have not been able to maintain their employment even though they might wish to. The third group in the currently qualified labor pool is those who are not willing to work. These people have worked within healthcare and have made the decision to step away. Whether that's for a period of time or permanently, we don't necessarily know. This can be due to burnout, the moral distress and moral injury of working over the last several years, which has been a uniquely high intensity period for the healthcare sector. It also could be for safety concerns, which safety can include access to personal protective equipment, feeling like the staffing levels around them are not safe, or perhaps the patient population that they are working with. They're no longer feeling safely able to care for. So the other group to consider is those individuals who are not currently qualified, but could become qualified healthcare workers through education and training. So about that training, it can be unavailable depending on the type, and is typically slow and expensive to complete, depending on which healthcare credential you were discussing. However, it's where much state health policy attention goes. Increasing, say, the number of nursing slots is a very common response when employers are having difficulty recruiting and retaining nurses. We're also currently competing with other fields, particularly for lower wage roles within healthcare, and those other sectors may be able to increase wages more quickly because they are able to raise prices. There are also all the laws and rules here within Washington State that limit who can legally provide various healthcare services. An interesting trend in 2023, the workforce challenges are becoming so severe that we're actually seeing some expansion of roles and expansion of scope of practice, which traditionally has not occurred very often here in Washington State. And I'd say that's one definite policy trend, while at the same time we are still creating new professions for work that was previously unregulated. So people from now on who say want to be music therapists will need to meet the required qualifications set by the statute and by the Department of Health if they wish to enter that service line. Overall, most of the difficulties experienced by the healthcare workforce existed before the COVID-19 pandemic, but overall, I think we're finding they were made a lot worse over the last 3 years. And kind of the last piece I'll leave you with is that to a certain extent, we can't even quantify how bad our workforce challenges are because we lack fundamental health workforce data here within the state.